There we go. Okay, so I'm going to kick things off. We can go to the next slide. Lisa and I are going to kind of bounce between the two of us. So we're going to talk about, is it anxiety? Is it autism? Is it both? Ways to sort of recognize and understand some of those differences. Next slide. So anxiety can present lots of different ways. It's defined as being fearful, worried. It could be a feeling of dread, of unease, and sometimes being fearful or having a sense of unease can be a healthy thing, right? If you're in a dangerous situation, a degree of anxiety is appropriate. However, when we see too much of these feelings, or these feelings are taking over or interfering with our daily functioning, that's when we start to worry about anxiety causing problems. Next slide. So when we do see that anxiety symptoms are persistent or getting worse, or they're interfering with daily functioning, or they're affecting us in physical ways, we're having racing heartbeat, sweating, could be trembling or shaking, you could have sleep or GI problems, that's when we start to think about, could this be stepping into where we would call it an anxiety disorder? Next slide. And there's different ways that anxiety might present itself. So if you think about someone who is anxious, who is putting their anxiety outward in an externalizing way, they may be having tantrums, they may be arguing or refusing a lot. They might ask repetitive questions over and over again because they're worrying about something that's coming, or they might elope because they're feeling anxious in a particular situation. Other kids may internalize their worries. So they may be more withdrawn. They may just be worrying, thinking about things, and they're not necessarily putting those feelings out there for others to be able to see. You might see that they're more sad, more distracted. And sometimes these are the kids that the way their anxiety presents is with changes in how they eat or how they sleep. Next slide. And what we know about anxiety in the autism population is that autistic people do have higher rates of anxiety. So depending on what study you read, anywhere from 20 to 80% of autistic people at any age can have anxiety symptoms. If we look specifically at children, it's around 20 to 40%. Independent autistic adults report about 55% of them also have anxiety symptoms. And, you know, people asked in the chat, how do you know if a minimally verbal or nonverbal person is feeling anxiety? It can sometimes be difficult to recognize. You can look for some of those triggers like Ellen talked about, that are there certain situations that you're seeing behaviors happening more often? But we know that it is a little bit harder to measure when the person can't tell us exactly how they're feeling. And we know that symptoms of anxiety and features of autism can overlap with each other sometimes. Next slide. So if you think about someone who is anxious, they may be a little bit avoidant in certain social situations. They might have some trouble engaging in conversations or tolerating when things change. They might be a little bit obsessive. They might think about things over and over, or they might engage in compulsive behaviors over and over because that's part of how they manage their anxious feelings. They might be more sensitive to things in their environment, and they might just have a more negative outlook on the world because they're worrying about things so much. A person who has autism also can struggle with social communication. They often have trouble with transitions, and they like to have things have a routine. They don't like surprises quite as much. Sometimes autistic individuals will have perseverative interests and like to engage in the same activity or think about the same topics over and over. They may engage in some repetitive behaviors. They may have some sensory focused behaviors, and they have higher rates of feeling more irritable and moody at times. And so you can see how these behaviors and these symptoms can overlap, and it can sometimes be difficult to tease them apart. Next slide. And a couple of questions have come up from patients of mine talking about sort of, how does social anxiety fit into this? If you have a social anxiety disorder, how does that compare to autism? And there's also been some work looking at anxiety in autistic individuals to try and define their anxiety, which is sometimes a little more unique or nuanced, right? So there's this description of atypical anxiety, and that's where an autistic person who is anxious has a degree of worries or has symptoms of anxiety that are a little bit unique. They might worry about the routine, or they might worry about new situations or about their restricted interests. They might have kind of unusual fears, like a fear of babies crying or the happy birthday song or trees. They might have more worries around social situations, but not necessarily because they're worried about rejection. They're just worried about the situation itself. And their compulsive or ritualized behaviors, so those repetitive tendencies that they may engage in, may not be driven by a worry or a desire to prevent a negative outcome the way a person with obsessive compulsive disorder might be engaging in a ritualized behavior. In social anxiety, we see that people who have true social anxiety disorder are incredibly stressed and worried about social situations. And that can really overlap with characteristics of autism. You know, the other thing that we see with social anxiety is that when a person with autism is struggling in social situations, they may feel more anxious. They know that this is something that's hard for them. And so sometimes those two can also overlap. And it may not always be something that the individual is expressing. They're not saying, I'm nervous in this situation because social situations are hard. And they may not ask for help in this situation. They may not entirely understand that their anxiety is driven by some of their social challenges. Next slide. So I'm going to pass it off to Lisa to talk about how we diagnose anxiety.
All right. Thanks so much, Amanda. So now that we know what anxiety is and how it can appear in autism, it's really important to understand how to determine if your child or loved one has anxiety. We've had a lot of questions in the chat, and I want to remind folks that we will have an opportunity to answer some of those questions at the end of our talk. So hang with us. Hopefully we'll touch on some of these important questions. And if we don't hit it, we'll try to catch your questions at the end. So anxiety is really typically diagnosed by a mental health professional, somebody like a psychologist, a psychiatrist, a social worker, or a therapist, though other doctors like developmental pediatricians or neurologists may diagnose or facilitate an initial diagnosis of anxiety. Because anxiety can sometimes be hard to identify in autism, particularly in non-speaking or minimally verbal folks, it's really important to trust your gut. And if your current doctor is unsure, ask for a referral to a specialist, somebody who has worked with individuals with autism and anxiety before. Next slide. A formal evaluation for anxiety will likely include a visit with your doctor to review your child's current symptoms, their behaviors, the coping skills or strategies that your child is using when they are feeling anxious. And as always, the more specific you can be, the better able your doctor will be to help you make an accurate diagnosis. Share how your child's anxiety has impacted your child's daily life. So are they avoiding specific activities or situations? Are they showing increased stress in particular situations? And have any of these challenges changed recently? Next slide. Data collection can also take many forms. Sometimes standardized data collection, that is things that you fill out on questionnaires, can be helpful for a clinician to sort of evaluate the degree and extent of your child's anxiety. But informal data is also really helpful. So the impact that you're seeing, the observations that you're making in daily life. When we think about formal data collection, I want you to think about standardized rating scales from multiple sources. So your doctor might ask you, your child's teacher to complete some standardized questionnaires. This helps us get a picture of your child's symptoms across settings or environments, and can be really helpful to give your doctor a full picture of what's going on. In addition, some of the measures that you see listed here, like the PROMIS, really lend themselves nicely to ongoing monitoring of specific behaviors and symptoms. So some doctors will use these rating scales over time to help you monitor your child's needs and progress as you see them over time. Next slide. This next step here takes some time and energy. So in order to make the most of standardized rating forms, I want to share just a few helpful tips. First, when you fill out those forms, I want you to try not to rush. Try not to cram it in the 5 minutes before your visit. Take some time to think about this when you have some time to set aside and really consider your responses. Also, take a moment to familiarize yourself with the rating interval. So every questionnaire is going to ask you about a different time period. They might ask you about just the last week in your child's life, or they might ask you to reflect on the last 6 months or so. If you feel like you need to clarify any of your answers, feel free to add some notes in the margin. I love it when my patients add notes in the margin that help personalize their responses on these standardized questionnaires in a way that's meaningful for your child. This is really helpful if you're not sure how to answer a question because your child is non-speaking or minimally verbal. And it'll say something like, my child says they're anxious. That could be a question on a questionnaire. And you might make a note and say, listen, my child doesn't say they're anxious, but here's what I observe that indicates to me that I think they might be feeling anxious or worried. In addition, bring your own expertise into the process. And again, this might be how you're observing your child relative to the specific questions that are asking, that the forms are asking. So again, you might see a child who's repeatedly asking questions or seeking verbal reassurance. And those might be things that you really want to specifically note on those questionnaires if they weren't captured in the standard question set. And then finally, I would encourage you to ask your doctors to share the results from all of these rating forms with you. You and your child have a right to review and understand all of the test results. And it's actually really helpful for you to look at those results alongside your doctor and offer some feedback about whether or not you feel the results are matching your observations and your lived experience. Next slide. All right. So even still, many of you know that these standardized rating forms don't always capture the full picture, even when we follow all these tips and we try to offer our observations. But I want, for all of these reasons, it's really important to also share your informal observations, and that might be in those notes on the margin. There may be other ways where you can do that as well. For example, sometimes parents and caregivers may track structured data on a specific behavior. For example, how long it takes your child each day to get out the door to go to school if your child's avoidant, school avoidant. Or other people like teachers or therapists may share specific observations from their work with your child as well. Make sure you bring all of those notes with you or share them with your doctor in advance of your visit. Next slide. All right, finally, your doctor is going to take a look at all of the data that they've collected through standardized questionnaires, interview with you and your child, and make a determination about whether or not your child's symptoms meet criteria for a specific anxiety disorder based on the DSM-5 or the Diagnostic and Statistical Manual, which is really the book that defines all of our mental health conditions. You can see here a listing of several specific anxiety disorders. These range from things like separation anxiety, which might be one way we see anxiety present in much younger children, to specific phobias or generalized anxiety. I know in the chat there was a question about agoraphobia. That's another specific anxiety disorder included in the DSM that includes a number of specific criteria that would define that particular anxiety disorder. Once your child has a specific anxiety diagnosis, and maybe even before you have a formal diagnosis, you're going to want to be thinking about what you could do to help. So let's cruise on to the next slide here. And next slide. Fortunately, there are a lot of things we can do to support and treat anxiety. Today, we're going to be reviewing these 4 things. We're going to talk a little bit about some environmental and behavioral supports. We'll talk about parent training, a specific form of therapy called cognitive behavioral therapy. And then Dr. Bennett's going to wrap up with some conversation about medication as well. Next slide. All right, so as let's take a minute to review some environmental and behavioral supports. These are things that you can do at home, no appointments needed, to set your child up for less stress or lower anxiety. I want you to think about things like maintaining a regular schedule and routine for your child. This allows for predictability for anxious or worried children. Be sure to preview transitions and changes in routine. Use social stories and visual supports to try to prepare your child for new and upcoming events. Try balancing more high stress activities with low stress or relaxing activities, and try not to schedule too many high stress activities all at one time. Timing also makes a big difference. If you can, avoid rushing and allow extra time for your child to complete tasks, particularly those they find challenging or anxiety provoking. Remember to provide lots of praise and reinforcement for your child's attempts at stressful tasks. And allow time and space to decompress and de-stress, particularly during and after stressful situations. We've had some recommendations from our case report today about incorporating OT, and this may be another important way to prioritize some of your child's sensory motor needs. This can be through different accommodations like noise canceling or noise minimizing headphones. Somebody made a recommendation in the chat for the Loop brand headphones, which are great. They're not too bulky. So definitely things you can do to sort of prioritize your child's sensory motor needs. Next slide. All right. Next, I want to make sure that we talk a little bit about parent training. You guys have, many of you have probably experienced parent training in different capacities, and I want us to think today about how anxiety parent training can be helpful for anxiety. So Ellen mentioned this earlier, but anxiety in a lot of ways can be a vicious cycle, right? Imagine if your child is nervous and your first instinct might be to rescue your child and help them get out of whatever situation makes them feel anxious. But every time we do that, every time we avoid or run away from those anxiety-provoking situations, it teaches our body, it teaches our children that we must have escaped certain death, and that it was a good thing we escaped that, and our body's going to start to feel even more anxious and stressed the next time we face that same situation. Next slide. All right, so let's take a little look at parent training in action. Many children have significant anxiety around doctor's visits and medical procedures. So I want you to think about these two scenarios, right? On the left-hand side of your screen, you see option one, where there may be a situation where your child needs to start a new medication and your doctor has requested that you come in for a blood pressure check to make sure that your child's blood pressure is okay with that new medication. You take your child in for a quick check after school on the way home, right? You just sneak it in to a busy day, you add it on top of a busy school day. Your child immediately entering the office starts kicking and screaming, runs out of the office as soon as they see the blood pressure cuff. They're very stressed and anxious. You didn't get the what was the outcome? That consequence was that you didn't get the blood pressure checked, but your child was able to leave the office and potentially even find or see a reward to help everybody calm down on the way home. In the second Sorry, folks, I think I just got muted. If I need to do anything to adjust my sound, team, let me know if there's something I can do to change here. In that second option on the right, you can see, again, your child started the same medication, but what do? We start to preview the appointment. We create a plan for your child, including all the specific steps, maybe a social story to preview what's going to happen when they go into the doctor. You allow them to explore and to practice blood pressure measurement at home or in the office. And your child's able to sit, maybe stressed, but still able to sit for that blood pressure check and had success with that. With that sort of practice and preview, you can see that option two is going to help really reduce anxiety over the long run and help your child access or tolerate a very stressful situation. All right, next slide. Now, I said we were going to talk a little bit about a specific kind of therapy, cognitive behavioral therapy, or CBT. So what is CBT? Well, CBT is a very well-researched therapeutic modality that is effective in reducing the symptoms of anxiety and building positive or effective coping skills. Next slide. CBT is really based on the idea that how you think can determine how you feel and how you behave. There are a few key elements to consider when we're using CBT for anxiety and autism. First, it's really important to help a child with autism first build their capacity for accurate emotion identification. This can be uniquely challenging because of some of the core symptoms of autism, where your child may have difficulty recognizing their emotions accurately and precisely in the moment. We also have to address or challenge irrational beliefs and automatic thoughts. And we're going to talk about what that means in just a minute. We also want to be sure to incorporate safe and supported opportunities for exposure or practice, and to help your child build and implement more effective coping skills and problem-solving strategies. This will include addressing and supporting their sensory motor needs as well. Next slide. All right, so let's go ahead and think about how this applies to us. I want to run through a quick CBT example for how this might apply to us. Let's imagine that we have to give a presentation at work. You can see here two sort of sequences for how this situation might pan out, from thoughts to feelings to behaviors. In that top line there, you can see you had to give a presentation at work, and your immediate thought is, I'm a terrible speaker. I will sound stupid. I'll probably lose my job. I'm totally going to mess this up, right? From there, your emotions are highly anxious, 8 out of 10. And your behavior might then result in you calling out of work, getting in trouble with your boss, skipping out on the presentation, becoming so anxious that you do have difficulty completing the presentation. But on that second line, you can see with a slight change of your thoughts, you might change a whole sequence here. So if you change your thought to, I know the material, I have some expertise here, I'll be able to refer to my notes if I'm feeling unsure, that's going to contribute directly to a lower rating of anxiety. It doesn't mean you're not anxious at all, but you're maybe not as anxious as if you were telling yourself you were going to be a total flop. And then you complete the presentation much more successfully, avoid things like losing your job, maybe even get some praise from your boss. So that's an example for how CBT might apply to us. And I want on the next slide here for us to think about how this might apply to a challenge that a child might face. So on this slide, you can see here now the situation we're talking about is I lost my backpack on the ride home from school. Right? Stressful situation. You could imagine that an anxious child might think, my mom's going to get mad at me. She'll probably punish me. She'll take away my Xbox. I won't get to do anything fun because I messed up, right? Or I'm a bad kid. But if we can help that same child learn to change their automatic or negative thoughts, we might move the needle on their anxiety. So if we can help them understand, mom cares about me, she wants me to do well in school, she knows the bus driver's phone number, she can help me track down my backpack. Changing those thoughts will again help your child change their emotional reaction and thus the resulting behavior. On the next slide here, though, I want to talk a little bit about how we can modify cognitive behavioral therapy for individuals with autism. Obviously, the range of needs that individuals with autism have are going to be highly variable, but many folks find more benefit from cognitive behavioral therapy if it's modified in a few key ways. So there are lots of ways that we can sort of adjust the intervention, the therapy, to meet the profile of your child, particularly what their core features of autism might include, what their cognitive and language needs are, and what other specific or individual needs they have. Next slide. First, I want to think a little bit about preparation. Make sure that your therapist understands your child's profile. Share evaluation reports and behavioral support plans for your child, and give your child's therapist permission to talk to other treatment providers or educational professionals. I want you to also think a little bit about what session structure and format would be best for your child. Will they do better individually or in a group setting where there are peer models? Would they benefit from shorter session length? So is an hour too long? Will your child fatigue or become overwhelmed in longer sessions? Would they do better virtually or in person? And do they need to stretch treatment out across a longer period of time to allow for more skill building and practice in between? Next slide. We also want to think about how to support your child's core features of autism in treatment. Do they need more or less support to build social competencies? Do we need to work on building their self-awareness and emotion identification skills? How can we promote things like social engagement? For many anxious children with autism, anxiety and social challenges can be a vicious cycle. And Amanda talked a bit about this as we think about some social anxiety specifically. Next slide. I also mentioned we want to talk a little bit about cognitive and language needs, and this might include modifying therapy tools to be developmentally appropriate, or placing more emphasis on the behavioral techniques in cognitive behavioral therapy, working in coordination with other behavioral modalities like ABA, allowing for the use of more visual supports and extra time for processing and practice. Next slide. And there are lots of things we can do to support engagement. This includes involving your child in goal setting, incorporating their special interests or affinities into treatment. We're going to talk about that in a minute, and incorporating specific reinforcement or motivation related strategies. On the next slide, we're going to talk about some parental involvement. And it's really important that you as parents or caregivers are involved in the therapy process. Share with your therapist any specific cultural or family values that might be relevant for your child's current symptoms or challenges. Ask your child to teach you some of the skills they're learning in therapy, and take advantage of parent-only sessions where you can really build your skills in supporting your child outside of the therapy hour. Your child's obviously with you for many more hours during the week. Let's see. I want to mention here before I go into the next slide, just quickly. Of course, parents can also experience anxiety, and just like our children, anxiety can run in families. So it's really important to make sure you're seeking your own individual support if you find yourself anxious or worried more than you'd like to be. An anxious parent caring for an anxious child will often sort of increase stress and anxiety for everyone. So be sure you're sort of checking in with yourself around your own stress level and anxiety, and make sure you connect with some supports for yourself if that would be helpful or applicable to you. The good news is CBT works for everybody, and can be really helpful for parents as well. Next slide. We want to make sure we're planning for generalization really from the beginning. So generalization can be more difficult in autism. This can happen through opportunities to build in real life kind of in vivo practice, not just role play, and also by coordinating or leveraging your home and community-based providers to partner with you in your therapy goals. Next slide. We already covered a case example, so I'm actually going to go ahead in the essence of time and skip this particular slide, but I want to just quickly highlight that when you think about CBT in action, it's really important to think about how you can incorporate your child's own specific interests. This really helps to increase engagement and motivation. On this slide here, you can see two of very prominent evidence-based programs for CBT programs or interventions for anxiety. Things like the Facing Your Fears program or the Coping Cat are really two of the most well-researched protocols for anxiety in children, and can pretty easily be modified for individuals with anxiety as well. I've also included on the next slide here some books that you might find helpful. We know that especially now, it can be very difficult to find a mental health therapist with expertise in autism and anxiety. So if you're having trouble accessing mental health counseling or CBT, or if you're on a wait list, definitely take a look at some of these resources that might help you learn new ways to support your anxious child at home. And I'll pass it back here for the last few minutes for Amanda to talk us through some medication options.
Okay, we can go to the next slide. So when should we think about medicine for anxiety? Next slide. So why are we even talking about medicine, right? CBT and all those behavioral strategies that Lisa just talked about are first-line treatment. Therapy is always going to be first-line treatment when we're talking about managing anxiety symptoms. However, in this population, about 20 to 30% of autistic people are taking a medicine for anxiety. And the way I explain this to families is there are situations where medication may be appropriate in addition to therapy. And it's typically when the anxiety symptoms are creating enough problems that they're impacting function, and or you need to sort of get them under basic control in order to really benefit from the therapies that you're receiving. So if anxiety is really impacting school or learning in a significant way, if it's really interfering with the individual's ability to participate socially or their own self-esteem, if it's impacting their quality of life, and in some cases, if it's impacting their ability to participate with their therapist to manage their anxiety symptoms, to learn how to do that long term, a short-term treatment with medication may be warranted. Next slide. So what we know about medications for anxiety and autism. So there are not very many FDA-approved medicines for anxiety in children, period. However, there are many that are used off-label and with pretty good success. The medicines that are most effective are going to be used in combination with all those behavioral interventions that Lisa mentioned. And it's always important to make sure that we're addressing other medical needs or other behavioral symptoms that may look like anxiety or impact the anxiety or interfere with the medication trial that we're thinking about using for anxiety. Next slide. So let's talk a little more specifically about medicines. Okay, next slide. So the medicines that are often prescribed for anxiety are in the class of selective serotonin reuptake inhibitors, SSRIs for short. There's a whole bunch of them. There's a few there. These are ones that are most often prescribed in the pediatric population, but also used for adults. These are ones that have been studied in some kids. Buspirone is another medication that is sometimes used. It is in the class of anti-anxiety medicines. That's the class that it's in, and it's the only one that I know of in that class. Sometimes antihistamines can be used. Hydroxyzine is one that can sometimes be used to reduce anxiety symptoms. And then for short-term, as-needed treatment, benzodiazepines can sometimes be used. We'll talk about all of these very briefly in a little more detail. Next slide. So in thinking about any medicines, right, every medication, there are pros and there are cons. So for anxiety medicines, a medication may make therapy more effective. It might reduce some of the irritability and agitation that might be presenting in that particular individual. In some cases, most of these medicines are going to provide 24-hour coverage, so they're kind of there working in the background all the time, taking the edge off of some of those anxiety symptoms. And again, so that the individual can participate in life and participate in therapy. And then there are some that can be used as needed for situational anxiety, going on an airplane or getting a lab drawn, things of that nature. But all medicines have side effects. And it's important to know that, and it's important to be ready to ask about them. Medications may not address all of the symptoms that a patient has, particularly if there's anxiety and irritability. One treatment for anxiety may not fix some of those other behaviors that are being seen. And most of the medications that are prescribed or offered were studied mostly in adults, a few in adolescents. Again, there have been some studies in young children, not very many at all in people with autism. So we are using them off label to treat symptoms that seem to respond well in typically developing adults and adolescents. Next slide. So the SSRIs are used most often. They can reduce anxiety symptoms. There have been some studies looking specifically in children with autism who have restricted or repetitive behaviors, and the SSRIs do not seem to have an impact on that particular behavior. So I would never treat a child with repetitive behaviors with an SSRI thinking that that's going to resolve it. But there have been some reports of improvements in irritability and agitation. If a child is able to express that they truly are worried, an SSRI could be helpful. And again, those improvements have been most often reported in adolescents and adults, but sometimes these medicines are used in younger children. All medicines have side effects. SSRIs can cause behavioral activation. If you think about someone is nervous, cautious, worried, if we take that away, they might feel more energized, a little happier. And sometimes if we overshoot, they can do some unsafe things. They can become a little more hyperactive. They can become a little more irritable. That's something to always look out for. And sometimes these medicines can impact sleep and appetite. And individuals on the spectrum do seem to have higher sensitivity to these side effects. So we need to just watch them much more closely and always be thinking about like starting at low doses and being very cautious as we would prescribe these medications. Next slide. Buspar also can reduce anxiety symptoms. It has been reported to sometimes impact the restricted and repetitive behaviors and irritability. It has fewer side effects than the SSRIs. It also is maybe a little bit less effective, but if someone's not able to tolerate an SSRI, it can be an option. And it does have some reported issues with appetite changes and sedation that we need to be aware of. Next slide. So hydroxyzine is that antihistamine that I mentioned. So it does have some impact on anxiety symptoms. It's also sedating. And so someone who is particularly anxious and it's keeping them awake at night, a hydroxyzine medication might be an option because it could sort of help with the insomnia and the anxiety. And if a child has allergies, it's not a bad allergy treatment to think about because you could potentially help with a couple of symptoms there. And the nice thing about hydroxyzine is that you're not committing to taking something every day. It could be just taken as needed when allergy symptoms are high, anxiety is high, insomnia is high. Side effects are sedation. So if you are taking it during the day, it could be a problem. There can be some dry mouth and dry eyes, just like any antihistamine, and it can make some people a little bit nauseous. And it does seem like it's not working 24 hours a day like other medications.
Right.
It's potentially only lasting a few hours. So it's more of a short-term treatment. Next slide. The last is the benzodiazepine. So, these are used as needed for short-term situations like going to the dentist or getting on an airplane. They can help with anxiety. They are used to treat seizures and sometimes can be helpful for sleep problems and agitation. There is a higher risk of individuals having the opposite effect from what you would expect. So you give a medicine that you're hoping is going to reduce agitation, seizures, anxiety. Some people will have the opposite effect and become more agitated or more activated. So you always need to kind of be prepared and maybe do a trial run before you take it before a dentist appointment. And long-term effects with these medications are more concerning. They can affect cognition if they're used regularly. They can be quite sedating. They can cause dizziness. Long-term use can lead to dependence, and overdose can lead to death. So we are very careful, thoughtful, and frankly, don't use these any more than we absolutely have to. But for a child that has a very clear trigger of a certain situation, a very low dose of a benzodiazepine could be helpful in those circumstances. Next slide. So I think it's just really important, nobody is jumping at the chance to put their child on a medication. We always want to start with the behavioral interventions first. But if you are even thinking about it or someone is offering you a medication, ask questions, ask lots of questions. Learn as much as you can about this treatment that's being offered. Make sure you remember what you're treating. Repetitive behaviors are not likely to go away just with a medication treatment. They're likely to remain. Do you know what behaviors you're trying to treat, and is there a way to track them? How does your family member's anxiety present itself so that you can keep track of if the treatment is working or not? Are you going to keep a diary? Are you going to use those pre-visit questionnaires or rating scales that your doctor provides? But have a plan with your prescribing physician about how you're going to track behaviors and what behaviors you expect to see change if you're going to try a medication. Next slide. So thinking about your learning loop that Amy talked about, right? So, in terms of how you're going to be informed and inform others, it really is, talking with your child's providers about their current health status, about any concerns that you have. Then complete those pre-visit questionnaires if your doctor sends them to you. That's incredibly helpful to make that visit more effective in terms of talking about the things that might be showing up in day-to-day life. Collect data in between and share that with your doctor as well. I love the notes on the side that Lisa talked about. That's super helpful. You won't remember them when you get to the visit, so write them down somewhere so that you know what you want to talk about. Learn about your treatment options. So if you're talking about medicine, learn what your options are and learn about those pros and cons. Ask lots of questions, but also learn about your treatment options around behavior interventions, different therapies, who can provide those therapies, where you might access them. And then share what you've learned with others. Share them across your team, share them with others in your child's life. We know that anxiety is more common in this population, and the symptoms can overlap and be a little bit confusing sometimes. We know that behavior therapy is incredibly effective to manage anxiety symptoms, and what that looks like might be different for a toddler or a minimally verbal child than it would for an adolescent or a young adult that is verbal. And if you are thinking about a medication, or if someone is talking to you about a medicine, remember the medicines have side effects, but can sometimes be very necessary to maximize the benefits that your family member might receive from behavior intervention. Next slide. So the last thing is just to share some resources. The Autism Speaks medication decision aid is great. It's like a little workbook that I give to family members to kind of help them think through what questions they have about medicines, what concerns they have, what they want to know from their provider. Makes that visit much more effective. And there's also a really nice one-page article on strategies for managing anxiety symptoms in individuals with autism. So it's a nice little tip sheet that you can download. And I'm going to put in a plug because the holidays are coming up, and this is our last Family Echo for this series during this calendar year. But on Friday, our team here at CHOP is going to be hosting a family echo specifically focused on how to manage the holidays with your autistic family member. So thinking through strategies around Thanksgiving, Christmas, school changes, all those things, that's what we're going to touch on Friday. We'd love to have you join. And I think they're going to put the link in the chat if you'd like to sign up for that. Next slide.